Hello everyone, good morning. I'll continue to report about speech and language disorder. According to Van Riper in 1984, cited in Harvard 2003, which states that speech is abnormal when it deviates so far from the speech of other people that it calls attention to itself, interferes with communication, or causes the speaker or listeners to feel distressed. According to Perkins, 1977, defined speech impairment as unintelligible. When we say unintelligible, it is ununderstandable. Abuses the speech mechanism. What are those speech mechanisms? The respiratory at the lungs, the phonation at the larynx, and the articulation of the mouth, or culturally or personally unsatisfactory. That is speech disorder. When can we say that the person has a speech disorder? So in determining whether or not a speech disorder exists, the person's age, education, and cultural background are taken into consideration. So mo na siya dapat ang i-consider aron mahibawaan nato nga naa ba siya speech problem or disorder. The speech of a 3-year-old child is naturally unintelligible. When we say unintelligible, it's naturally nga dili pa jud nato sila masabtan, dili nato magets ang ilang ginapang istorya. And kung dili man nato magets, dili man nato masabtan, it doesn't mean nga na sila speech disorder. But the speech patterns of the 30-year-old person that deviates quite markedly from adult speech would indicate that the presence of speech problem is there. People who speak English as a second language may mispronounce certain speech sounds, but this cannot be considered as a speech disorder. Any deviation in the condition of the breathing and voice producing mechanisms, including the integrity of the mouth and oral cavity, can cause speech disorder. There are speech-related problems that cause ineffective communications like problem in voice, articulation, and fluency. We have voice disorders. Voice disorders are deviation in phonation such as in pitch too high or too slow. Taas hanting kaayog tingog or hinay kaayog tingog, or frequency too loud or too soft. Quality pleasant or irritating to the ears. Speech can be hoarse or may lack appropriate inflection. When we say hoarse, rough, or harsh na voice. According to my research, resulta daw ni sa sore throat or resulta sa siging syagit, siging singgit hantod mapagaw na ang tingo. So, vocal resonance is affected by impedance in the flow of air. Hypernasality results when there is too much airflow and the voice seems to come from the nose, or in the case of hypernasality, the airflow is too little and the voice seems to be embedded by severe cold.
Okay, Sarah, say, put the baby in the buggy.
Put the baby in the buggy.
Take Teddy to town.
Take Daddy to town.
Do it for Daddy.
Do it for Daddy.
I eat cake and ice cream.
I think an ice cream.
Go get the wagon.
Go get the wagon.
Say, I see the sun in the sky.
I need a none in the sky.
That is voice disorder. Another problem that causes ineffective communication is articulation. Articulation disorders are errors in the formation of speech sounds. According to Haycock in 1933, who compiled a classic manual on teaching speech, describes how the speech organ go through a variety of shapes and patterns, and how the breath and voice are molded to form words in correct formation of speech sounds. So any deviation from the process of correct articulation results to error in pronouncing sounds and words. So, ang mga specialists agree that articulation disorders are not simple at all. Why? Because they are not necessarily easy to diagnose effectively. Dili sila dali nga ma-diagnose. So, articulation disorders vary in degree of severity. They may be mild, mild lang, moderate, katamtaman, or severe. Grabe na. In mild or moderate cases, siguro ang bata, they will just mispronounce mga certain sounds or use immature speech, no? But the speech can be understood. masabtan gihapon sila bisan na mga mispronunciation. The problem usually disappears as the child matures. Mawala ra siya pag mudako na siya. But if it persists for a long period of time, referral to speech specialist should be made. Pa-check up na dyan nato siya. A severe articulation is present when many speech sounds are pronounced incorrectly. Halos tanan na dili tama nga pagka-pronounced. The speech becomes unintelligible most of the time. When we say unintelligible, dili na siya masabtan, dili siya mag-gets. In this case, the speech specialist complement the work of the special education teacher. Another problem is fluency disorders. Fluency disorders interrupt the natural, smooth flow of speech with inappropriate pauses, hesitations, or repetitions, unlike normal speech that makes use of rhythm and timing so that the words and phrases flow easily. Fluency disorders are characterized by unnatural variations in speed, stress, and pauses. Now, under fluency disorders, we have this cluttering and stuttering. What is this cluttering and stuttering? Muna siya ang example sa fluency disorder. In cluttering, speech is very fast. Paspas ka istorya ang bata. With extra sounds and mispronounced sounds that make speech garbled and unintelligible. Paspas ka mo istorya, pero dili na siya masabtan. According to Jonas in 1976, stuttering is marked by rapid-fire repetitions of consonant or vowel sounds, especially at the beginning of words, and complete verbal blocks. The cause of stuttering is unknown. Wala di siya naibawanon sa hinungdan. It is a disorder of a childhood that appears between the ages of 3 and 5 after the child has acquired fluency in speech. It is common among males than females, and occurs more frequently among twins. According to ASLA, or the American Speech Language Association, defines language disorders as the abnormal acquisition, comprehension, or expression of spoken or written language. The disorder may involve one, some, or all of the phonologic, morphologic, semantic, syntactic, or pragmatic components of the linguistic system. Individuals with language disorders frequently have problems in sentence processing and retrieving information from short and long-term memory. Children with language disorders manifest delays or lags in language development. So nagaluding ilang una-una, dugay kay makaprocess ang ilang una-una. They lack age-appropriate language comprehension or receptive and expressive abilities in the basic facets of communication, namely listening, speaking, reading, and writing. However, a child who has language delay may not necessarily have language disorder. A language delay implies that a child is slow to develop linguistic skills but may acquire them in the same sequence as normal children, according to Reed 1994. Generally, all features of language are delayed at about the same rate. On the other hand, a language disorder is present when there is disruption in the usual rate and sequence of the milestone in language development. Now, there are 5 factors that contribute to language disorders of a child, according to Chaney and Rufrodoma 1982. Number 1, we have this cognitive limitations or mental retardation. Cognitive limitation can be caused by genetic condition like problem during pregnancy, problem at birth, nagkaroon ng problema after birth, or can be poverty. No? Can also be because of mental retardation, maybe below average intelligence or lack of skills for day-to-day activities. Number 2, we have environmental deprivation. Na-deprive ang usa ka bata. That's why wala na practice ang ihang mga language. Wala niya na practice how to communicate with other people. So deprived siya, wala siya socialization, wala siya educational recreation. Maybe wala siya ginatugutan mo gawas. Maybe wala sila time nga mo gawas. That's it. Another one, hearing impairments. Have you noticed that those people nga naay problema sa ilang pangdungog, maglisod po sila og istorya. Atong amang bungol, maglisod po sila og istorya, no? So, the reason why sometimes naay language disorders because naay hearing impairments or hearing disorders. Another factor is emotional deprivation or behavioral disorder. Maybe gamay pa ang bata, he lack adequate interpersonal attachment that provide love, affection, or interest sa mga butang-butang. Siguro wala niya tun-an ang mag-pour out sa iyang kaugalingon, mag-istorya mahitungod sa iyang kaugalingon, no? So, nagkaroon siya og emotional deprivation or behavioral disorders. Number 5 factor is structural abnormalities of speech mechanism. As what I said earlier ago, maybe na-abuse ang yung speech mechanism. Nadaot ang yung speech mechanism, yung respiratory at the lungs, phonation at the larynx niya, ang articulation niya sa ihang baba, maybe nadaot, na-abused. Language may be delayed, disordered, or absent because of these 5 factors. Ang mga adults mo reward silang mga anak for efficient communication, maayo kay mo kanta, maayo kay mag-speech, maayo kay mag-oral, mo recall og mga information. Uban, they will punish their children because they are so sabaan, talking too much, participating conversation among adults. Lack of motivation at home to engage in communicating activities may discourage a child from developing his or her own skills in using vocabulary learned and expressing ideas. Now, as a result, problems connected with the form, content, and use of language may occur. So, magkaroon dyan ng problema. No? Form problems. Cover phonology, morphology, and syntax problems that range from difficulty or decoding spoken language, abnormal use of prefixes, to abnormal structure of words and wrong use of tenses. Another one, content problems, include semantic disorders manifested in poor vocabulary development, inappropriate use of words, and poor comprehension of the meaning of words. Use or pragmatic problems cover the inability to comprehend or use language in context or conversation on various situations. Here are some examples of language disorders. Number 1, Central Auditory Processing Disorder, or CAPD. It is a disorder or a problem in processing sounds attributed to hearing loss or intellectual capacity. She can hear, madungog niya, but hard to process or to understand. Dili jud niya masabtan. So number 2, aphasia. It is a language disorder that results from damaged part of the brain responsible for language. Another one is aphrexia, also known as verbal apraxia or dyspraxia. It is a condition where the child has trouble saying what he or she wants to say correctly and consistently. So maglisod siya istorya, dili niya ma-express usaon niya pag-istorya. So children with autism do not respond to stimulation, communicate little or none at all, and display deviant behavior that seem to be out of touch with the environment. Number 4 problem is dysarthria. Dysarthria is the speech condition where the weakening of the muscles of the mouth, face, and respiratory system affects the production of oral language. Children who have cerebral palsy or neuromuscular disorders suffer from dysarthria, as well as those who had stroke or brain injury.
1, 2, Colorado for the patient. Sound enough to yesterday.
Speech and language disorders that results from hearing impairments. The most devastating effect of deafness or pagkabungol and other forms of hearing impairment is on language development. Thus, persons who are deaf or hard of hearing manifest speech and language disorders as a result of conductive, sensorineural, auditory nerve, central auditory nervous system, and functional hearing losses. Deafness restricts the perception of the sound elements of a language and other sounds in the environment with or without a hearing aid. Depending upon the types of hearing loss, conductive, sensorineural, or mixed auditory nerve or auditory nervous system. In the outer, middle, or inner areas of the hearing mechanism, the greatest impact of deafness lies in the acquisition of speech-language skills. While deaf persons can develop their communication skills manually through sign language, our arbitrary gestures and movements, or orally through speech reading and auditory training. These adaptations cannot approximate normal speech and language development. Because of hearing impairment, pagkabungol, magkaroon og speech and language disorder. This is the end of my report about language and speech disorder. The next reporter will tell us more about programs, interventions, or activities that will help children with language and speech disorders. Thank you very much for watching.